Hello, Pain Free for Life members. Welcome back to another Monday 10-minute training. Today, we're going to be talking about how to treat bone spurs with microcurrent therapy. So, for those of you who don't know, let's talk briefly about what bone spurs are before we dive into how we can actually deal with them. Now, bone spurs are bony projections that develop along bone edges, and typically these are forming where your bones meet each other in your joints. They can also form on your spine as well, and in some cases, they can be very painful. The main cause of bone spurs is actually joint damage associated with arthritis, typically osteoarthritis, but really arthritis of all kinds impacts the joints, and damage can end up causing the inflammation to push bone out and it can grow into different areas. Most people will end up with bone spurs at some point in their life, but they probably won't notice them because many bone spurs, most of them, will actually cause no signs or symptoms. In some cases, though, bone spurs can cause pain. They can also cause significant loss of motion in your joints, which can make it impactful to just lift. So they can end up having a huge impact on your life. Now, bone spurs are challenging to heal, but it is not impossible. And luckily for everyone struggling with them in this group, chances are you already have one of our microcurrent devices, and all of our microcurrent devices are able to treat bone spurs effectively, especially and almost essentially when coupled with a rarely used attachment, the pencil electrode or pen electrode. This is pretty much essential to treating bone spurs effectively, in my experience. Now, the downside to this, because yes, of course, here we are saying we can help resolve these, but the downside is that treatment of bone spurs is really not the most comfortable experience in the world. Just as bone spurs that are bothering you are uncomfortable, treatment of them is probably going to be uncomfortable too. And I'll explain that as we go along here. First off, the first step of treatment is an optional step. And this is whether you have a scalar chi or not, realistically. But pre-treating the area with a scalar chi using just the basic 7 to 12 hertz protocol that I talked about in my training last week on Thursday, the long scalar training, not the Monday 10-minute training. Essentially, the scalar chi is enabling the development of a scalar wave. This helps to reset the cells at a cellular level and keep the energy level low. But in doing so, it eliminates resistance in tissue that could stall or delay treatment. So fundamentally, the use of the scalar chi is going to improve the chances of success, but it's not required. And all I would do in this case, if you have one, is add it into the treatment. 7 to 12 hertz, maximum power, and just point the scalar chi at the area of the bone spur and do it for about 5 minutes. After which, you want to switch to the microcurrent directly. Now, for this, as I said, all of our devices are capable of helping with bone spurs, and we're really wanting to use a program called Blue Stimulation. So it is available in all of our machines. And you're going to plug your pencil electrode into your device. So this is the pencil electrode. And I'm going to preface this with one of the tips in here is about using a conductive gel. If you have the Sana pencil, you can do this. If you have the Avazia pencil, which is kind of black with blue, I don't have one here, we don't really use them, and it has a bend on the end, then you can't do the trick because the use of the gel could damage the pencil. But with the Sana pencil, which is the one that comes in all of our kits now, you will be fine. So you're going to plug the pencil electrode in. So you're using your same wire that you'd use for your Y electrode. You plug it right into the bottom and it clicks. And then you're going to plug the pencil on the other end of the wire into your device. And I'm using an Evolution here. You could use any of our devices. Upon turning the machine on, I'm going to press the mode button until I have Blue Stimulation selected. If you're on the Pinnacle device, you need to scroll through your device and hit the middle button when you find the right one, the mode you want to select. Once you've gotten this on, what you're going to do is you're going to locate kind of the center area of the spur. And just for demonstration purposes, let's say I have a bone spur on the side of this joint on my finger. So I would put the pencil on the side here, and then I'm going to adjust the power until I can feel it by holding down the plus button. Okay. And what I want to do is I want to get it to that comfortable level at the start. Now, in the cases of using the pencil, you're using a very small electrode. So it's not always possible to feel the electricity. And that is something we need to tackle. So if you're not feeling it, so now I've held my power button down and I've got all the way up to maximum power and I'm still not feeling it. So what I would need to do is I would then turn this off and turn it back on again and go down to blue stem. And then I'm going to put either a bit of aloe gel, just aloe vera gel, on the skin, or put a dollop on the tip of the pencil, and I'm going to reapply it to the area. And I'm going to turn the device on again, go down to the mode, and with the additional aloe gel and this particular pencil, I will have improved my conductivity. So then I'm going to, again, hold the power down, and as I start to feel it, and I get to a comfortable level, I know that I'm good. So at that point, I'm going to stop. Now, remember, I already prefaced this. If you're using the curved Avazia pencil, you can't do the gel. The tip is not sealed in the same way. The gel could get inside the pencil and break it. This is a completely smooth tip. It's fully sealed, so you're not going to have that problem. So once you've gotten to this comfortable power level, you're going to actually keep increasing the power level. And you want to do this to the point where you're getting beyond comfortable. This is one of only a handful of treatments where we want to go to the point where it's kind of uncomfortable to treat. We normally want the electricity to be a gentle tingle. With bone spurs, we want the power level to be beyond that comfortable level. It's one of those situations, pushing it to the point where it kind of stings a little is probably beneficial. And as you're doing this, you want to apply firm pressure to the area in the middle of the bone spur with the pencil. And you want to keep pushing on it. This firm pressure combined with the increased power level is not going to be comfortable. And I said this at the beginning of the protocol. Treatment of bone spurs, just like having bone spurs, is not a comfortable experience. You want to hold the electrode with decently firm pressure in place for up to 5 to 10 minutes. And you want to repeat this process every few days. The reason I tell people, you might not want to do this daily, many people do, is because you don't want to end up bruising yourself from the pressure you're putting on there. But repeating the process every few days is a good tip. The goal here is to actually break the bone spur up, and it works. And we've had lots of people come back and say, this really does work. This protocol, as simple as it may be, has gotten rid of the bone spur, but it can take some time. So for those of you new to microcurrent, I do want to emphasize that very rarely do we ever want discomfort or more strength in the electricity than being able to just feel a little tingle. So don't let this scare you away. This is one of maybe 3 protocols where we push a little bit above comfort level out of the hundreds that we have. But in the case of bone spurs, it really is what has proven to work and what makes the difference. Most treatments with microcurrent are done at a comfortable power level, so do not worry about that. All right, everyone. So that is it for today's training session. If you have any questions, feel free to drop them in the comments below the video, and I will answer them as soon as possible. I hope you have a great week, and I will see you next week for another Monday 10-minute training. Thanks, everyone. Bye-bye.